Good evening. My name is Fred Adams. I'm the Vice President and one of the founding members of MediGap Advisors, and I'm here today to speak briefly on this year's Medicare Annual Enrollment Period and exactly what it means to each and every one of you listening to the presentation today. Just so everybody knows, I currently have the phone lines muted so we don't have any background noise or interference during the presentation. It should probably take me 20 or 30 minutes to get through the basics of AEP and what's going on right now. When I get done, I will unmute the phone line and take questions. If anybody has any questions that arise during the course of my presentation, if you're watching online and you have the Start Meeting Control panel in front of you, please feel free to go ahead and type your questions in chat. I will address those first before unmuting the phone line. So all that said, let's go ahead and get started. Today is December 5th, 2013. This year's Medicare Annual Enrollment Period is almost over. It ends Saturday, December 7th. And for most people in this country that are already on Medicare, you only have one chance each and every year to select a new Medicare Advantage product or to add prescription drug coverage. And that is during the annual enrollment period, which started October 15th and it ends 2 days from now, December 7th. Any new coverage that you elect to enroll for during that time, it's going to take effect January 1 of 2014. So just a quick little recap. If you currently just have original Medicare, you'll have the option to enroll in a Medicare Advantage policy if you would like, and I'll touch on some of the benefits of that shortly. If you have a Medicare Advantage and you have decided you don't like it, you can drop it and go back to original Medicare. If you have an Advantage plan and you want to change, you can change to another one. Your new coverage would start January 1. Or if you have a Medicare Advantage plan that does not offer prescription drug coverage and you would like to add that valuable drug coverage, you can change to a Med Advantage policy that also includes prescription drug care. And if you don't want anything to do with a Medicare Advantage, maybe you have a Medicare supplement policy and you're perfectly happy with that, well, this is the time of year when you can elect to purchase a prescription drug plan that would help you pay for those very expensive medications that you may need next year. So, what are some of the advantages of enrolling in a Medicare Advantage plan? A Medicare Advantage policy actually replaces your original Medicare. It's offered by a private insurance company, and any of these companies have been approved by the Medicare office, and the policies that they offer are going to have to cover at least as much as your original Medicare benefits. That means it'll pay for the majority of your hospital stays. It's going to pay for at least 80% of your Medicare Part B outpatient services. And most Medicare Advantage plans also include prescription drug coverage. Now, from my personal opinion, one of the huge advantages of having an Advantage plan over original Medicare is the simple fact that it gives you an annual out-of-pocket spending limit. If you have just original Medicare, the amount that you pay for your medical bills next year could literally be unlimited because there's no time when Medicare says, okay, you've paid your fair share, you're covered 100% the rest of the year. If you have a Medicare Advantage policy, you are going to have an annual spending limit, and depending on the plan you have, that limit could be as low as $3,400 or as high as $6,700. But even if you have one of the policies with a $6,700 spending cap, that's a whole lot more desirable than being on just original Medicare, where you potentially could spend thousands and thousands of dollars more than that next year. So what about the Part D, or the prescription drug coverage? Medicare Part D, it's a federal program that is designed to help subsidize the cost of some of your prescription drugs. Now, you're much like an Advantage plan. You're going to be purchasing your drug plan through a private insurance company, and that insurance company is going to be reimbursed by the Center for Medicaid and Medicare Services for some or all of the cost of your prescription drugs. And please keep in mind, if you have a Part D prescription drug plan, it only covers prescription drugs. It does not cover anything else. So let's look at a little more detail on Medicare Advantage policies. I already talked about the big benefit of having an Advantage plan, the simple fact that it gives you an annual out-of-pocket spending limit, which means the most you would pay for your covered medical expenses next year would be between $3,400 and $6,700. Another huge benefit of an Advantage plan, and this is also a benefit that's offered by any Medicare supplement policy that anyone on the line may have, is it extends your coverage for a hospital stay by an additional 365 days longer than original Medicare would cover you when you were in the hospital. And then one of the other very popular elements of most Med Advantage plans is many of them offer a variety of value-added services. Some include free dental services, free vision. Many of the more popular Advantage plans include gym memberships. Several offer a program known as Silver Sneakers that I know is very popular amongst the senior community. And others offer pharmacy discounts or potentially all kinds of other value-added benefits. A few more things about Medicare Advantage. Keep in mind that any policy like that, it has to cover at least as much medical care as if you just stuck with original Medicare. Now, one of the downsides of an Advantage policy is most of them do involve a network. Some of the lower cost, especially the zero premium Medicare Advantage plans, are HMOs. And if you have an HMO and you want to go see a doctor that's not in the HMO network, then you literally have no coverage at all. Now, most other Advantage policies are PPOs. With a PPO plan, you have your choice of a lot more doctors that are in the network, and you can even go see a doctor that's outside of the network if you would like. You just wind up paying a little bit more of the bill. Now, to have an Advantage plan, you have to be enrolled in Medicare Part A and Part B. And even if you get an Advantage plan that has a monthly premium of $0, you're still going to have to keep paying your Medicare Part B premium, which for most people is about $105 a month. Now, if you have an HMO, you may need to get a referral to see a specialist. So that's one more downside of going the HMO route. And you can only join or leave an Advantage policy during an enrollment period. And there's only 3 different times when you first join Medicare each year during this annual enrollment period that ends on Saturday. And then if you have any qualifying or life-changing event, that would be something like moving, having a spouse die, your insurance company goes out of business, things like that could create a special opportunity for you to enroll in a new Advantage plan during the course of the year where you wouldn't just have to wait until the actual annual enrollment period. Now, I think we already touched on the value-added services. These are not included in all Medicare Advantage plans. They do vary from one company and even one plan to another. But having the opportunity to potentially get free dental care, free vision benefits, getting that very valuable Silver Sneakers gym membership really can add a lot of value to somebody that has an Advantage plan over just sticking with original Medicare. So I'll answer any questions we may have about Advantage a little bit later on, but let's move on now and talk a little bit about prescription drug coverage, also known as a PDP. If you're purchasing a PDP, it's considered to be a standalone prescription drug plan, and that's going to help you lower the cost that you're going to pay for prescription drugs that you may need in the future, or even for drugs that you're already taking today. If you have original Medicare, very few prescription drugs are actually covered unless you're in a hospital. And the only reason I even say very few, because it really is a very limited number, is there are some types of treatment for cancer, chemotherapy that require certain medications that would be covered under Medicare Part B. But other than that, for your regular medications that you're taking when you're not sleeping in a hospital bed, Medicare is not going to help you pay for any of those bills. Now, when it comes to looking at a prescription drug plan, they don't all work the same. There are a few things that are kind of common from one company to another, but you need to look at a lot more than just what is the monthly premium. Because if you just go and buy the plan that costs the least premium every month, you may wind up spending more on your drugs than you need to next year. So any policy in 2014 that has a deductible, the deductible would be $310. We may see $325 here on my slide. That was actually the deductible this year. Next year, believe it or not, it's going down $15. So if you have a policy that has a deductible, it'll be $310. If it doesn't have a $310 deductible, then your deductible is actually going to be zero. Another thing to keep in mind when you're shopping for your drug coverage is make sure that you select a plan that works with the pharmacy that you want to use. Because you could get a policy, I will use Humana for an example. Humana's preferred pharmacy is CVS or Walmart. So if you're picking up your drugs at one of those two locations, you'll actually have lower copays than if you use that same Humana plan somewhere else. But probably more importantly than the pharmacies is the word formulary. And if you're not familiar with that, a formulary is just a list of drugs that your insurance company says these are covered drugs. And for the most part, a formulary list will be the same from one company to another, but they do all vary somewhat. So especially for anybody that's taking a brand name medication or a more expensive specialty drug, please, before you purchase any prescription drug plan, make very, very sure that you or that the agent that you're working with have very thoroughly checked to ensure all of your medications are on that formulary list, because if they're not, that insurance company is not going to pay any of the cost of those medications. So ultimately, when you're shopping for drug coverage, in addition to looking at the monthly premium, looking at whether or not there's a deductible, what you really truly want to know is when I go pick up my medications next year, how much money is the pharmacy going to ask me for? And once you have that piece of information in mind and you add what the monthly premium cost, you want to make sure that you purchase from the company that has the lowest total estimated cost. So at the end of next year, once you've paid your premium and bought all those drugs that you may need during the course of the year, you want to make sure that you purchase the policy that's going to have kept the most money in your pocket. And that's something that you can determine online on your own. The Medicare.gov website actually has a tool that makes that pretty easy to do, at least if you can poke around on that site and find it. Or, of course, you could reach out and speak with an agent that happens to specialize in the Medicare market, and they'd be happy to help you do that research. So the most important things you want to consider before you sit down in the next 48 hours and make a decision on which drug plan is going to work best for you is what medications do you take now or do you expect to take next year? What pharmacy do you want to pick your drugs up at? And what's the monthly premium going to be? Add that to the cost of those medications. Look for the company that offers you the lowest estimated total, and that's going to be the plan that'll save you the most money next year, at least unless your medication needs may change. Now, some Medicare Advantage policies, or if you're purchasing a plan that's just a Medicare Advantage, it doesn't cover prescription drugs. But there are also Medicare Advantage policies that include prescription drug coverage, and they're referred to as an MAPD, for Med Advantage Prescription Drugs. And much like other Medicare Advantage plans, if you're getting an MAPD, policy options are going to include HMOs or PPOs. So be very careful about selecting any HMO, at least until you're absolutely sure that the doctor that you want to go see is a participating provider in that network. There are a couple other types of Med Advantage plans. I won't go into them in much detail today. There's one that's known as a special needs plan. Those tend to be designed for people that have various forms of chronic health problems. So for an example, if you're a diabetic, you might want to look at a Medicare Advantage special needs plan that's designed just for people with diabetes, because it's going to have benefits built within that plan that are going to help you lower your cost even more than if you purchased a regular Medicare Advantage plan that wasn't designed for another diabetic. And the very last bullet point here on the screen, medical savings accounts. That is a type of Medicare Advantage plan that I'm actually asked about pretty often. Unfortunately, at this particular juncture, those products are only still available in a handful of counties throughout this country. So more often than not, when somebody asks for one of these plans, I'm not able to help them get it because it's not available in their zip code. But if you are looking at Advantage policies and you see one that indicates it's an MSA, I would definitely encourage you to talk to the agent that you're working with and ask them to explore that particular option. Where they are available, they oftentimes are, in fact, the best value for individuals in that area. So I think we've already touched on this, and we're getting close to the end of the presentation. But December 7th, 2 days away, it's the last day this year that you can take advantage of the 2013 Medicare Annual Enrollment Period. This period comes once a year. It only lasts about 45 days, and it's almost done. Once the clock strikes midnight on December 7th, you will no longer be able to submit an application for a new prescription drug plan or a Medicare Advantage plan until all the way at the end of next year, unless, of course, you're just now turning 65 or you happen to move or have any other sort of qualifying event that creates a special enrollment period. Now, I do know time is running out. Midnight on Saturday is going to be here pretty quickly. If you happen to need any assistance in selecting a plan, whether it's a PDP, a Med Advantage, or a Med Advantage that also includes drug coverage, you can certainly reach out to MediGap Advisors. Our phone number is here on my screen. It's 866-323-1441. We would be happy to assist. Again, that number's 866-323-1441. We will have advisors working late into the night Friday and Saturday as well. So please give us a call if we can help. If you are looking for some assistance, please call sooner rather than later, because my experience in past years indicates that by Saturday, or whenever December 7th actually is, the phone's ringing like crazy, and we have more messages and emails than we can usually get back to. So if you need our help, please feel to reach out, whether it's today, tomorrow, or if you want to wait till the last minute and try to reach someone Saturday. We will have most of our staff available, but demand for our services will be high, and there's no cost whatsoever to utilize the expert assistance of one of the advisors here at MediGap Advisors. We are simply here to help make the process as easy on you as it can possibly be. So I hope everybody got the facts that they were looking for this evening. You know, all of the information that I presented was truly just intended for educational purposes. I know that a lot of people, when they look at Medicare and then they see Part A, Part B, Part C, Part D, they tend to get very confused if they haven't dealt with it again. So we're here to help make understanding the Medicare maze as simple, as easy as it can be. I hope I've done that for some of you on the line today. Looking at the chat box, I don't see that I've had any questions that have come in there, so I'm going to unmute the phone line and see if any callers would like to ask anything. So I do have time for some questions if anybody has one this evening. If you do have a question, I just ask 3 things. Please state your first name so I know who I'm talking to. Let me know where you're calling from, because that may affect how I answer your question, since options are different from state to state and county to county. And then let me know what your question is so I can share some of my experience with you. One more chance. Well, if we don't have any questions, I will thank everyone for attending today. I hope that I've already answered any questions that you came with. If not, that toll-free number is 866-323-1441. Please give us a call. We would love to help. When you call, if all of the advisors in your state happen to be on the phone, please ask the receptionist to schedule an appointment with you as soon as possible. And if the advisor or if she offers you an appointment that's after Saturday, please let the receptionist know, I'm trying to enroll before the open enrollment period ends on Saturday. I need to talk to somebody right away. And if you do that, she'll get an urgent message to an advisor licensed in your state so they get you on the phone as quickly as possible and get you the help you need to get this taken care of while the window's still open, because it's about to close soon. So hope everybody has had a nice day, has a wonderful evening, and once open enrollment happens to end Saturday, I hope everybody enjoys a lovely holiday season. I wish you all the very best, and we're here to help if you need us. Thanks.